Hello everyone, welcome to Pristine Smiles. Today's topic is evidence based decision making. It will be covered in 3 parts. If you like the video, don't forget to press the subscribe button. Dentistry is evolving at a very fast rate. There is so much information on the internet about the various dental techniques, tests, materials, it can sometimes become overwhelming. This is termed as information explosion. There is a rapid increase in the amount of published data, and as this amount increases, managing this data becomes an issue. This can cause an information overload. This can cause difficulty in making a decision. We do not know what's right and what's wrong. The relationship between the clinician and the patient is changing. Patients are now becoming partners in the decision making process. We now have patients coming to clinics with information downloaded from the internet, some of which even the dentist may be unfamiliar with. So, how do we differentiate what's right and what's wrong? The traditional clinical problem solving model was mainly based on individual experience or information obtained from textbooks or by consultation with colleagues. The current model is the evidence based decision making model, and it comprises the clinical patient circumstances, scientific evidence available to solve the particular problem, experience and judgment of the clinician, and finally, patient preferences or values. So, evidence based medicine is the integration of the best research evidence, clinical expertise, and patient values. So, why do we need evidence based decision making? There are two forces that drive the need to improve the quality of life. First, we have variations in practice pattern, and second, assimilating evidence into practice. First, we'll talk about the variations in practice patterns. Now, the traditional approach of learning and practice, it relies mainly on authority, which means that rather than going out and seeking out the most current empiric evidence, the clinicians tend to practice the same way as they were taught in school. Then there is a gap between the time that current research knowledge becomes available and its application to care. This causes a delay in adopting useful procedures and discontinuing ineffective or harmful ones. There is a delay in integrating new evidence because there is a need for translating it into information which can be beneficial for both the clinician as well as the patient, because they are the decision makers. What I mean with this is that, say for example, there is a new treatment modality or a new material which can be used for the treatment of a particular dental problem. So what we need here is, first we need to make sure that this new evidence is actually going to benefit the patient. Learn how to incorporate this into our dental practice, and then explain the patient why this new evidence is better than the previous one. So there are so many new scientific insights which emerge every day. So we need a standard unbiased method to evaluate this information. Assimilating evidence into practice. You need to keep on updating yourself, attend courses, read extensively, make use of the internet and electronic databases and research. Advantages. Now let's break this down. It is objective. It is not influenced by any individual's feelings or opinions. It considers the facts. Then it is scientifically sound. It adheres to the requirements of the best scientific evidence available. It focuses on the patient and encourages better communication with patients. Then it incorporates clinical experience. It allows the clinicians improve their understanding of research methods and makes them more critical in using the data, thus allowing good judgment. It is thorough and comprehensive, and it uses a transparent methodology. It provides a framework for problem solving as well as for teaching. Now, everything has its own set of disadvantages. Now, evidence based dentistry takes time to learn and to practice. The infrastructure required costs money. It exposes the gaps in evidence. The electronic databases which are used are not always well indexed, and this can get confusing. So that's all for now. In the part 2, we will be talking about the PICO process and the ways of acquiring evidence. In the part 3, we will be talking about critical appraisal and evaluation of the outcome. So stay tuned for more videos. Don't forget to like, comment and share. Thank you.